We're seeing that there will be literally thousands of young men and women returning from Afghanistan and other places over the next year or two.
And there's had to be something that we can do for these warriors who have really dedicated and put their life on the line for us.
A group of physicians and administrators and nurses took 49 charts of patients who've been readmitted to our hospital at least once in 30 days post-discharge. And they all had pretty significant medical conditions, but social conditions and the lack of a social support system played a major role in their readmission.
We're hiring very qualified combat medics and corpsmen who have an amazing medical skill set that they are not going to be able to utilize otherwise in the United States after they get discharged. That we are helping these very frail, at-risk patients manage kind of their life around their health care and prevent them from actually getting readmitted.
When they're being discharged, that they forget to listen to their discharge plan of care. So when we see them, we make sure they understand their plan of care.
We're checking their house for the safety, we're checking their food, we're checking their bathrooms, we're making sure the medication's right.
They wanted to know if I was taking them all, and I showed them I have a little box there that I put in by the week. I put all the medication in the little box.
We have the medical records system on, and we go through a template that includes a mental health screening, a safety screening. We then find any red flags that might be happening, and we rectify them right there and then.
I think our patients and the coaches have a mutual respect that they develop very quickly.
I was kind of scared of what they would do, what they would ask and stuff. Oh, they were so good, and so I was so at ease.
I think the unique value that we provide to them is we're putting someone who has a critical thinking experience and problem-solving experience from the military who's been trained to turn it around to treat them.
We have patients who don't have family, who don't have support, who have pets that they can't feed, who cannot manage their own medications, who don't understand the disease process that they may be experiencing.
So every medic's trained to view red flags. We're just turning it around and saying, you're going to recognize this red flag on a geriatric, so then you're going to call, instead of calling a medevac, you're going to call the doctor. Or instead of putting a tourniquet on, you're going to rearrange their meds. So it's very similar, and it's much easier, but it's just as fulfilling.
A medic is the doctor on the battlefield. So he's operating, trying to save someone's life while people are shooting at him with a flashlight in his mouth. I mean, they've been there. So they have a feel about the human condition that I'm not sure everyone has. It's not nearly as medical, even though we do some vital signs and things like that, as it is social. Our motto is we treat all these patients like our grandparents.
Because of my background and training, I think I provide compassion.
I love all my patients a lot.
We would like every hospital in the United States to be doing this. We could save literally billions of dollars for Medicare and healthcare costs, but even more importantly than that, we could add to the quality of life of some of these people just by loving on them.